Have you ever stopped and wondered, is the way I touch myself now really the way my body needs it, especially after 60? If you've asked yourself that question, you are not alone. In fact, this is one of the most common concerns I hear from older men. Not just whether it's okay to masturbate at your age, but how to do it safely, respectfully, and in a way that actually supports your health instead of draining it. Hi, I'm Dr. Jocelyn, a urologist with 5 years of experience helping men stay confident, connected, and healthy in every stage of life. And today, we're going to talk openly about something rarely discussed, but incredibly important: how to masturbate safely after 60, and the 3 big mistakes you must avoid. This isn't about shame. This isn't about performance. This is about protecting your circulation, your prostate, your hormones, and yes, your emotional well-being. So if you've ever felt uncertain, frustrated, or even a little embarrassed about this topic, you're in the right place. Before we dive in, let me ask, where are you watching from today? Drop it in the comments. And if men's health is important to you, make sure you like this video and subscribe, because we need to talk about the things no one else will. First, let me bust a myth right away. Masturbation is not only normal, it's genuinely healthy, especially as we get older. Too often men past 50 or 60 start to wonder, does my body even need this anymore? Some even feel ashamed for still wanting it. But here's the biological truth. Gentle, regular self-stimulation keeps blood flowing through the penis, nourishing those delicate tissues. It supports prostate health by helping clear built-up seminal fluid. It lowers stress hormones like cortisol, protecting your heart and mood. And it even helps you sleep better by calming your nervous system. So yes, it's safe, yes, it's healthy, and yes, you still deserve it. The only catch, the way your body responds at 60 or 70 is not the same as it did at 20 or 30. And that's where men run into trouble. As a urologist, I've sat across from thousands of men who whisper these same concerns. Doc, things don't feel the same. Is something wrong with me? Why does it take longer now? And I'll tell you what I tell them. Nothing is wrong with you. It's not failure, it's not weakness, it's simply biology. With age, skin becomes thinner, nerve endings fire more slowly, blood vessels become more reactive and can be strained more easily. So the way you touch yourself, the habits you built decades ago, may not serve you anymore. The good news, once you adjust your approach, things often get better, not worse. Let me show you exactly how, by breaking down the 3 most common mistakes men over 60 make when it comes to masturbation, and more importantly, what to do instead. Mistake number 1, rushing. Here's the first and biggest mistake I see: rushing. You might think, so what? I've always done it fast. But at this stage of life, rushing quietly works against your body. When you rush, your nervous system stays in alert mode. Blood vessels constrict instead of opening. Your heart rate rises, but not in the calm, healthy way. Instead, in a stressed, shallow breathing kind of way. Instead of nourishing blood flow, your body stays on edge. And that means you may finish, but you won't feel satisfied. Worse, your arousal may become harder to trigger over time. The fix? Slow down. Give yourself time. Even just 5 extra minutes of slowing down and deep breathing makes a world of difference. Think of it as a reset button for your nervous system. When your body feels safe, vessels soften, tissues awaken, and sensation deepens. Not through pressure, not through speed, but through presence. Mistake number 2, using too much pressure. The second mistake is one that creeps up without men realizing: using too much pressure. It usually starts innocently. Maybe sensitivity feels lower, so you grip tighter to feel something. But over time, this creates damage. The penis isn't just skin and muscle. It's a network of delicate sponge-like blood vessels and sensitive nerves. When you use a tight grip repeatedly, nerves become desensitized. Tissues compress and strain. Some men even develop what's informally called death grip syndrome, where they can only respond to one specific type of pressure. The result? Intimacy with a partner becomes more difficult. Natural arousal feels harder, and pleasure itself feels dulled. The fix? Loosen your grip. Use a natural, fragrance-free lubricant. Focus less on the finish line, more on sensation. Think of it like massage, not machinery. Your goal is to keep tissues healthy, circulation flowing, and nerves alive and responsive. It might feel strange at first, but with patience, your body relearns sensitivity. Mistake number 3, ignoring the emotional side. This one surprises most men, ignoring the emotional side, because let's face it, Most of us were never taught that our emotions shape our arousal, but they do. Shame, stress, negative self-talk, these live in the body. They show up in your muscles, your breathing, even your blood flow. Over time, that quiet emotional weight can turn into performance anxiety, disconnection from your body, even a loss of desire, not because your body can't respond, but because your heart doesn't feel safe. The fix? Start with compassion. Remind yourself, this is not about performance. It's about connection, healing, care. If you struggle with shame or self-criticism, talk about it with a doctor, a therapist, or even a trusted friend. There is strength in opening up. Because when your emotions feel safe, your body follows. Pleasure becomes natural again, not forced. So, what does safe, healthy masturbation after 60 actually look like? Here's your simple action plan. Cleanliness first. Wash your hands, keep towels or tools clean, create a calm space, turn off distractions, breathe deeply, use lubrication, protect delicate skin, and enhance sensation. Listen to your body. If something feels uncomfortable, stop. Honor the experience. Don't rush. Don't judge. And remember, if you notice pain, swelling, or changes in your erection or ejaculation, don't ignore it. That's when you should see a doctor. I want to reassure you of something important. You are not broken. You are not past your prime. You are simply in a new phase of life. Your body isn't asking for less pleasure, it's asking for different pleasure. Slower, gentler, more mindful. And when you respond to your body with that kind of respect, it responds back. Often in powerful, surprising ways. So tonight, or whenever you feel ready, give yourself this gift. Not performance, not pressure, just presence. You deserve that. If this message helped you, let me know in the comments. Where are you watching from? And if you haven't already, hit like and subscribe, because your health, your pleasure, and your confidence are worth protecting. Remember, age is not the end of vitality. It's simply a new chapter. And in this chapter, dignity, comfort, and strength are still yours if you give your body the care it deserves. Until next time, stay strong, stay curious, and take good care of yourself.